Steps 1 through 5 may be performed in any sequence. Assess the respiratory status, the presence of drainage on trach dressing or ties, appearance of the incision. Check the prescriber's order for frequency of trach care. Gather equipment and supplies, the towel, the trach care kit, hydrogen peroxide, sterile normal saline, sterile gloves, clean gloves, trash can, 4x4 drain sponge.
The 4x4 drain sponge is going to be inside your tracheostomy kit.
Identify the patient, explain the procedure, and provide privacy. Place the patient in Fowler's position. Head of bed should be elevated 30 degrees or higher. Raise bed to working height. Place towel across patient's chest. Perform hand hygiene and apply clean gloves. Open trach care kit using sterile technique. Well, I mean, that's just a big hitter.
Yeah.
Open saline bottle and lip into trash can.
Do I need to take this off first?
My bad. Why y'all didn't say something?
I did.
Well, they didn't. They got all the forms.
Remove oxygen delivery device.
Remove oxygen delivery device and place near patient's airway. Remove soil trach dressing and discard. Remove clean gloves and perform hand hygiene. Now open the trach care kit using sterile technique.
Okay, so what you want to do here is you do not want to open it where it says open. Okay, so it says open here, but we're not going to open it there. So on your kit, you have 2 small compartments and 1 larger compartment. You're going to open it from the larger compartment towards those smaller compartments. Okay. And you'll see why as we go.
Open saline bottle and lip into trash can. Pour saline into 1 compartment of the trach care kit. Open hydrogen peroxide and lip into trash can. Pour hydrogen peroxide into 2nd compartment of trach care kit. It typically works better if you pour the hydrogen peroxide into the compartment closest to your patient, and you'll see why.
Yeah, so you're always going to put the hydrogen peroxide closer to your patient and the saline in the compartment away from your patient.
Apply sterile gloves. Good luck with this. Yes.
These are kind of like the hair dye gloves.
Remove sterile drape and apply to bedside table without touching non-sterile objects. Creating an additional sterile field. My bad. Carefully place contents of the trach care kit onto the sterile field.
I have broken sterility.
It's an automatic 0.
I dropped sterile water onto my sterile drape. So I would get a new sterile drape. Because remember, if I make it wet, it's no longer sterile. Okay, now I'm going to remove my contents. So you will have 2 pipe cleaners, 2 cotton tip applicators, you'll have a brush, you'll have a split gauze, and you'll have some 4x4s. And lastly, you'll have some trach ties. Okay.
Place sterile cotton tip applicators and pipe cleaners with one in with one of each in peroxide compartment and one of each in saline compartment. Use sterile cotton-tipped applicators and pipe cleaners. Nope. Use sterile cotton-tipped applicators moistened with hydrogen peroxide. Clean the incision site and the tooth flange. Thoroughly rinse with cotton-tipped applicators moistened with saline. Use each applicator only once and discard. With non-dominant hand, grasp the inner cannula and twist or squeeze to unlock. Remove the inner cannula gently by pulling it outward, out towards you and align with its curvature. Continue to hold the inner cannula with this hand throughout the cleaning process. While holding the inner cannula with the non-dominant hand, immerse in hydrogen peroxide compartment. With dominant hand, clean the inner cannula with pipe cleaners or nylon brush or pipe cleaners. I messed that up. While holding inner cannula with non-dominant hand, remove the inner cannula from the hydrogen peroxide and immerse into the sterile saline compartment. Rinse the cannula well. Tap the inner cannula on the inside of the saline compartment to remove excess solution from the inside of the cannula. Replace Replace the inner cannula into the trach opening, lock into place. Apply sterile drain sponge under the flange of the trach tube.
So this hand is not sterile because I was holding that. So I got to use my sterile hand to replace this. Okay. At this point, sterility is done.
Change the trach ties if soiled. They are. Leaving the old ties in place, thread one of the new ties into the slot on one side of the flange. Bring both ends of the new ties together.
And you're going to start on the side that already has a knot tied. So when you tie your knot, it's going to be on the opposite side. So you know which one is your new ones and which one is your old ones. It's hard to do.
You're doing good. Bring both ends of the new ties together. Take them around the patient's neck, keeping them flat and untwisted. Thread the end of the tie next to the patient's neck through the slot from back to front. Tie the ends with a square knot. Cut. Cut off long ends. Ensure 2 fingers can be placed under the tie. Cut and remove the old ties once the new ties are secure.
So I'd come over to the other knot and cut it right at the other knot to take off the old ties.
Replace oxygen delivery device. Remove towel and discard. Reposition the patient for comfort. Remove gloves and perform hand hygiene. Record and report trach care, appearance of incision, characteristics of secretions, patient's respiratory status, and patient's tolerance of the procedure. Sterility is maintained throughout the procedure, and you follow the correct sequence of actions. You have 10 minutes, because it says 10 minutes.
10 minutes.
And you must have 21 of 28 to be successful. So you have to get the ties on to be successful. Well, that